This side of the world, it's awkward and hard to openly and honestly talk about sexual health around COVID. So teenage pregnancies were on the rise.
There was a spike in teenage
Pregnancies around COVID. Information is one thing, and then people having access to minors has also a different angle. But then if we solve information, we solve a lot. People have 1,000,000 and 1,000 ways they can ask the same exact question. If something wasn't in our rules, users would get the default response. Let me
think.
It was a hack, and it was feedback from a group. It was feedback from some of the group sessions.
AI chatbots can replace human educators for sexual reproductive health. Fact or fiction?
Ooh, that's tough.
Hi there. Welcome to AI Healthbit Africa, the podcast where we explore how artificial intelligence is transforming healthcare across the continent. I'm your host, Valentine Kamau. On today's episode, we're talking about an innovation that is helping people access trusted sexual reproductive health information with dignity, cultural relevance, and privacy. Joining me to unpack this conversation is Irving Amukasa, who is the founder and CEO of SophieBot. Hi, Irving. Welcome to the podcast.
Thanks for having me.
Yeah, nice to have you here. And we'll just dive right into it. Just before we get into the tech, I'd love to just hear your story, your personal journey, your background. Just take us through that.
Okay. Elevator pitch. First of all, I'm Irving Amukasa from SophieBot. And at SophieBot, we use AI to answer your questions on sexual and reproductive health. Yes, I just said sexual and reproductive health because this side of the world, it's awkward and hard to openly and honestly talk about sexual health. My journey starts in 2016. I'd been playing around with the technology behind chatbots, so rule-based chatbots. How can we automate conversations? And there was a call to action by the United Nations Population Fund asking innovators like myself to build and solve for sexual health. It was a one-to-one connection. Here's a problem where it's awkward and hard to openly talk about sexual health. Here's a technology I've been playing around with, doing silly things with that can be applied to sexual health. Because we started off with answering 3 questions only. I've built a first prototype and deployed it. But since then, it's been a journey of growing with the technology because the technology we're using today didn't exist then, and had to learn and grow through the entire process.
Definitely. Very interesting journey there. And so question, what's your background in your education? How did you get to actually learn how to build this?
Yes. It's surprising to most people that I'm an actuarial science student, but then before I joined school to do actuarial science, I was already an Android developer. I knew how to develop Android apps. So straight from high school, I knew mobile phones were going to be the future, the device everyone is going to be on, and then I need to learn to build technology. I need to learn to talk to that. So I started off, built a few apps, and then learned about chatbots. It was a flinging idea, how do people automate conversation? How do you talk to not someone else, but an agent out there? And I learned the technology behind chatbots. The technology we're using then was I need to stop being a techie. AIML. It was rule based. If a user says this, write this. If a user I used it for silly stuff. There was one time you could put on the entire Bible on that technology, and you could ask it questions by verse, Proverbs, and I was doing silly things like that. So the technology then was old. And I think I was one of the first few people to be able to port that technology to be able to support on Android because it came with the phone itself. It sat on the phone and it loaded once you loaded the app to work on the phone. Yes.
That's a very good insight to know that you've always been a techie. That's what I'm picking. Even just after high school, you're developing this Android bot, and then
and then learning chatbots. So it's curiosity. Most people you learn. Most techies who are good at their craft didn't learn all they learned from school. It was interest in the space and obsessively learning and pursuing the interest, and that's how they built out the tech skills. Yes.
Yeah. Great background there. Now, if you can just take us through the innovation, why sexual and reproductive health, and what piqued your interest in that specific topic?
Yeah, it could even go to the name itself, SophieBot. So SophieBot herself, the call to action from the United Nations Population Fund had a persona called Sophie, and the story goes, her life takes a wrong turn because she didn't have the right information on sexual health, early pregnancy, the work. So the call for application was that compelling, that you have the tech skills. There's a huge problem here. And also, normally it's 6 years on, we'd never have this conversation comfortably. The most successful platforms out there, they've diverge into humor. So we try to dispel humor when you talk about sexual health. Every few weeks, there's a controversial topic online where people don't have the right information on sexual health. From misconceptions around vasectomies and whether or not they affect libido. The last time I was online, it was people using self-test kit to vet partners before unprotected sex, with all it is that. So first was the call to action from the United Nations Population Fund and showing us how big it is. But then every day there's always a conversation that's driven by misinformation, not having the right information on sexual health. The starkest has been around COVID. So teenage pregnancies were on the rise.
There was a spike in teenage pregnancies
around COVID. Information is one thing, and then people having access to minors has also a different angle. But then if we solve information, we solve a lot more.
With misinformation, everything just gets lost in there with the bad outcomes. So then you applied for that call from UNFPA.
Yes.
And so how was that process like, and how did you emerge on the other side victorious?
I keep telling people you're lucky, and they keep telling me we worked hard. But for me, it was can I tell the story?
Yes, please.
So the exam right before long holidays, I got my machine stolen, my laptop stolen from me. So it's long holiday. It's long holiday. I already know about the ecosystem. The ecosystem. The idea comes, I've been playing around with chatbots. Let me build the technology. I built a landing page and the first version of the app that could only answer 3 questions. Hi, what is sexual health? And does pulling out work? Only answer 3 questions. It's rule based. You have to define, anticipate questions, and then deploy that and have a product that fast MVP ready on the Play Store before we filled in our application. Filled in the application. We got shortlisted for the final pitch. Spent a week refining with Nylab, refining our pitches, and then on pitch day, I think it was on a Thursday, the 4th of August, 2016. Selected one of the successful teams. But then that's when the work began. Because remember, we only answered 3 questions.
You only had 3 questions.
3 predefined questions, because you have to spend a lot of time doing that. Once the news, the thing, it comes with press. You get press, news gets out. Now we go back to working on updating questions. UNFPA give us a very good resource. They have a peer mentor curriculum. Whatever they teach to peer mentors, it comes with all definitions, all terms, what they teach to the peer mentors. It also comes with a section with FAQs. pull all-nighters with a couple of my team members to consistently update the knowledge base. The problem is that like every single time we had new information, we had to update the knowledge base, update the app, and then users kept getting notifications of two apps. So the funding then was 1 million Kenya shillings from and you've paid.
That was a good start.
If we were lucky. And then we hit the road since then. If anyone else out there is looking to apply for things, have a it's not opportunistic that I'm looking at the cash prize. You're looking at the opportunity and what are you solving for?
Yeah, what you can do
and
with your skills.
And you need to like put something out before you like the first early version of the first early prototype of what you're building. Put it out there. I put it out there. It even went some hassle goes to a point where you have to make them know you exist even before they formally vet, formally shortlist and vet. So being part of the ecosystem also sort of helped, because some NILAB people knew about us even before the application.
Yeah, so putting yourself out there with your skills, and now getting the right opportunity.
Yes. Should I talk about the other? Yes, because the other opportunities we've gotten as a result of that, but it follows the same process. People in the industry building something out there, filling in the application as best as you can, and then going to an extra length, and people in the ecosystem, the decision makers, at least know you exist.
Great. That's a really good journey. And now that you're also touching on how other health tech innovators can actually learn from your experience. They don't have to reinvent the wheel. So you've mentioned something about the UNFPA curriculum.
Yes.
So you used this, the information, it's what now you're training the AI model on. You're using that.
That back then we weren't training, so it's rule-based. It was
rule-based.
You're defining the rules. So if a user asks this, answer why. If a user asks this, answer why. I'm pointing that out because it's very important for when we're now training.
Now you're
training technology. So
now take us through that evolution from the role-based to now you can actually train your own AI models at some point, maybe build on top of others. Just take us through that journey.
So build that first version, updated it to like 3,000 questions, supporting you 3,000 questions. You go to a point where we even supported, like, if a user just ask one word questions, like just HIV or just symptoms or just UTI, the system could pick it up, but it wasn't enough. People have 1,000,000 and 1,000 ways of they can ask the same exact question. If something wasn't in our rules, users would get the default response, let me
think.
It was a hack, and it was feedback from a group. Like it was feedback from like some of the group sessions. We had let me think about it, but so it wasn't. It was infuriating to users. We had two options at that point. First, either pivot to technology that can learn from previous questions to answer new questions, or scale down the solution, become a menu-based system, like press 1 to learn about STI.
Press 2 for this.
So those are two rules, and then being as ambitious as we are, being as a bit of delusion, but then as stubborn and ambitious as we are, we choose path 1 where we could learn about technology as it was emerging and then try to implement it on our system. That whole system had been asked over 30,000 questions. So
30,000
questions from over 30,000 questions from over 6,000 users, because it was on our Android app, Facebook Messenger, and Telegram. And to a point where we were getting questions from people outside Kenya. So there are a couple of times we're getting questions in Korean, questions, and they're all getting it with, let me think. Let me think about it. Let me think about it. Because it was, the system was, it was rule-based. 2016, as it was happening, we are in the third AI hype cycle. So that it was the second bot cycle. So it was driven by Facebook Messenger, letting people build bots on Facebook Messenger. But then the technology we're using didn't exist. We had to study. So we have this huge data set of questions, 30,000 questions plus. I cleaned through 3,000 and then the 3,000 I kept training. Whenever new technology comes up, train and test with it and see if it performs. We don't deploy it. Train, test with it, see it performs. We don't deploy it. But as that year that we were founded, a paper was written that enables a lot of the technology that's running right now. Defined the technology we're using now. So this is in 2022. Right, it's 2022 November. ChatGPT gets released in 2023. So by then, GPT itself, like the technology behind ChatGPT had been released, but then it was accessible to only researchers could make use of it. It wasn't as good. It wasn't built to chat. It was built to generate the next question. When that happened, I studied every course. There's a progression of knowledge where from academic papers to the software that I as a developer can use to now build. I plugged and played with 3,000 questions, only 3,000 questions I had cleaned through and tested it out with that. And it performed better than anything else that we had built. I sat at home, cleaned through the rest of the 30,000 questions, and then retained a technology for that and deployed it. And it was active. And it performed way better than the older technology we had that was rule based, and performed better than all the other technology I played around with. It got to a point where we hadn't considered people telling the bot thank you for getting information, because the last conversation would hit let me think let me think about it, and the conversation would end there. So in our data set there's no time where we had anytime someone saying thank you
or saying hello and good morning.
Hello. We had lots of hellos, because people were nice, and we added a lot of demos on that, and we deployed it. So we deployed it in November 2022, because 2023 that's when ChatGPT, I think I think the ChatGPT boom was end of 2022, early 2023. So then few weeks later, ChatGPT is released. Again, lucky, right at the right point at the right time. There's a call for applications by Vilgro Africa, and they fund and support that model. Then they even fund us to deploy it on SMS. A thing I knew was I cannot trust the bot to generate novel new answers. So I was using the technology to understand the many different ways people can ask the same questions, but then refer to vetted answers.
It's like you have a reference curriculum.
So from the data set, so to learn, not generate novel new answers, but to learn from,
to refer to what is already there.
To refer to the data set. Yes.
Great. I like how you're taking us through the journey of there's the design, you've designed this, there's the deployment, there's now sharing with the target
audience.
Target audience. So it's design, deploy, and share.
Yes.
Now we are at you've mentioned there was the access through the WhatsApp, there was the Telegram, Facebook, and even SMS. So how was that? How did you get people to actually know about this? Like the first 100 users or the first 1,000 users, how did they come on board, and what was the feedback?
Yes. I think I'd like to point out this community. So the first, even us getting feedback on, like, people are saying thank you to the technology. The first feedback, I'm terrible at this socially, but then like for business work, I'm good at it. Is building a community of people who are early adopters who will give you feedback fast. So the first time ever in 2016, I was in a community of developers, Android developers, and they're the first people to give us feedback. Back then, I was in JQuat. My first classmates were the first people to hear about it. There's even a time we were given a stand, so we didn't actually apply for JQuat Tech Expo. Where there's a community of early adopters, people who like to trying new things out.
Tech.
Trying new things out, and they'll feed about it. So the 2016, the first few hundred people, the first 250 people were people from my community of Android developers, people who are our students alongside with. 2022, the first a few hundred people who get Twitter, a community of people on Twitter. The Twitter community moved from small WhatsApp groups to people. We talk people on Twitter. Like it's a ecosystem and subculture on its own. The same way car people on Twitter have the same ecosystem.
So that ecosystem, the community, I like the aspect of community that even the first testers of your chatbot were actually people you know. So the community is always important.
Yes.
And now that you mentioned JQuat commonality, we are both JQuat alumni. So shout out to JQuat.
Yes.
So then now the tech is out there. You're building for SRH in Kenya.
Yes.
So very, interesting topic first. And taboo topic, how did you get to localize and for first Africa, then narrow down to Kenya? Because our contexts are very different. How did that localization go?
So localization, step one is the Unified Mentor Curriculum. All answers are from that. The answers are from that. Step two is us being the team vetting every question, every answer, because you are cleaning through the data set. You're going through every question and answer and adding it. Step three is supporting typos. So people say hi in million, hey, supporting all of that. Add that, include that, all that messy data in the data set that you're training our technology on. And then we support one-word questions. Making sure the technology supports one-word questions. So if somebody has a topic, if it's HPV, just ask HPV and provide answers. Get answers on that. Support typos in the question. So making sure the technology supports typos. In the question. Lastly, make it accessible where the users are. Where a huge value proposition is we can deploy our bots anywhere. We can deploy technology anywhere. So anywhere that supports chat, we can deploy it there. So it was we started off as an Android app supporting messaging platforms, but then the key feature in 2022 we wanted to do was SMS and WhatsApps, because that's right at the fingertip. Even when some people, not everyone is always online. Some people are occasionally connected. So and sometimes you get bundle offers only for WhatsApp messages. So supporting people who are occasionally online, and then also supporting SMS. And lastly, now what you're on SMS, but you only support English answers. If you ask a question in Swahili, you get hit by our default. The developers haven't taught me that language yet. Our data has some questions in Brazil, Portuguese, like Portuguese, Brazilian, Korean, and all those questions get fed to the answer. Or the developers haven't taught me that language yet. So the last thing was SMS. In Swahili, supporting Swahili. Our vision was we have our data set of 30,000 plus questions. If we just translate it to a new language, can our technology support that new
language, Swahili?
So we worked with, and I've gone through the process of going through 30,000 questions by myself. I was going through treasure myself again. It's painstaking, mind-numbing work. So I worked with a CBO in Nyanza called Tembea Kenya, where we give them an Android app and they could be fed questions line question and answer pairs one by one, and they could translate it in real time to Swahili. Yeah, so we did that and retrained our model with just adding the Swahili data set, and it could support English and Swahili. Yes,
that's a really very good journey, especially now that localization. I like the aspect of Swahili, and even yesterday when I was trying out the SophieBot and actually put in something in Swahili, and the first thing is, of course, I said hi in Swahili, and then it also said hi in Swahili, and then I was like, this is very accurate and very accurate Swahili, so that localization bit is really good. I also like the prompt engineering that you are talking about, that design philosophy that you took, even involving that community-based organization. That's really great. And now, have there been any? What's the feedback from the users now that it's deployed? They're using it. What's the feedback?
So the feedback is one, the general information we're really good. Sometimes is people and people specifically in distress want a level of personalization we can't give. So come to us on SophieBot to talk about having to deal with a yeast infection. SophieBot will talk about what we taught about yeast infections. We won't recommend we won't work on diagnosis. We won't recommend actual treatment. We'll give you general information. So the feedback is and it's for people who are testing it out, like really, like, does this even really work? They get feedback really nice and fast. But then there's an extra level of people expectation where they want us, once you've done something well, the next thing is, can we diagnose, can we personalize it? And we don't want to sell tech that isn't available yet. Tech that isn't reliable yet. The technology is good at giving you information, general information. The technology is not good at diagnosing. The technology
and telling you the medicine.
Yes, because we don't. That's a risk we don't want to take. The technology can't lead you to actual services. So I can't know I am in this location because we want to keep you private. So there's this content where people trying out first, testing out, does this thing even work? Are really excited and they're like, give us good feedback. But then people at the point of distress, because we don't know. It's anonymous. We don't know who you are, but then we keep track of questions for quality. So we notice sometimes some people in distress expecting personalized information. We don't offer that and provide that.
So this distress would mean, like, someone, give me an example of a distress.
I just had a yeast I was treating a yeast infection. What should I do? We'll give you Sophie will explain what yeast infections are. We can't treat distress in the case of sexual assault. We have answers to handle that, but then generally we can't take you to a specific police station. It's I have been sexually assaulted. Do step 1 as recommended by the UNIFEM curriculum. There's a specific level of personalization. I think it's driven by the large ecosystem of tools. The technology can't give you links. So if you notice larger language models, they give bigger technology. They give you links to websites that don't.
These are the LLMs. Give you links. Some are legit, actually there. Some are not.
Some are not. Some are not there. So we cannot offer links. So there's that extra level of personalization that we can't offer yet. One of the questions I remember, we got a couple of you. I was just treating a yeast infection. What do I do? Sophie generalizes all the conversations to what we've heard about yeast infections. There's that extra level of personalization from people in distress that we've not been, and it keeps me up. Or like we haven't delivered on yet.
So it's something that you're still keeping you. Awake.
We're working on it. We hope advances with the bigger technology people trying to use AI for everything else will help us advance it on our end. But then the technology isn't there. The technology isn't
but it's something. Tech is always evolving. Every day it's evolving. And now you alluded to something about data privacy, data protection. We are aware, like recently, the recent launch of the Kenya AI strategy. Previously in 2024, the AU Continental Strategy on AI. And also as recent as 26th August, today is 29th August, the UN also launched a framework on AI, and they are being very intentional on how all these AI innovations are going to be deployed.
Yes.
If you can just talk about the data privacy, the protection, how are you using this AI in a responsible way, in an ethical way?
Yes. So step one is do not make claims you can't deliver. I even forgot to say this. People trying to like do small talk with SophieBot, because you want to discourage people flirting. Yes, we've had examples of people trying to flirt. We have. So step one is make claims, the claims you're making. So we answer questions, we provide your questions information, we provide general information. We don't diagnose. We can't provide you to exact links. We can only give you general information on sexual. So first is the claims you make. Second is the data you're collecting. Know what to collect. So there's a movement in AI, in technology, where people want to collect everything. Your information log, your location, all the metadata. We don't collect any of that. We only collect the question you ask and the answer we provide for quality control. Now that you're collecting also phone numbers through the platform, so WhatsApp and SMS lets you collect phone numbers, and you even need the phone number because the technology needs a phone number to where am I sending back conversation. Do not use a phone number for something else. We don't send promotional. We don't take phone numbers and then send promotional messages.
Materials and messages.
No, because it's your privacy we're protecting. There is a large aspect around compliance, being HIPAA compliant. For startups with smaller teams, do not collect what you don't need. Don't collect something you need to protect, because then you don't have the resources to protect them. And then lastly is hygiene. So it's technology hygiene. So deploying your solution securely, making sure no one else aside from you can write to the where you're deploying it. This is a bit more more technical. So there's an example. They use the same technology you're using, T-App. You remember there's a US app called T-App.
No.
So it was where women could post like, is this man a red flag? Does anyone know? So it was an app in the US, and they're using this kind of the same backend technology you're using, but then they didn't secure it well enough, and people who are aggrieved actually went and compromised that technology. So if you don't collect what you don't need to protect, what doesn't improve your product, should any breach happen, whatever they get is worthless, because what they're getting then the IDs. People had to like upload IDs to verify the actual information. For us, you're anonymous.
You're anonymous. Everything is anonymized.
No question will be tied to you specifically unless the phone numbers. But then again, protecting that. But even recently there was, if you make your chat items searchable on larger language models,
they can appear on Google. I saw that.
So then, not like making one link searchable should make the your entire system. So know what to collect and only collect what you need.
Only what you need.
It helps down the road with compliance. Yes.
Yeah, that's really good. The ethical AI, responsible AI. Great. That explanation really takes us through SophieBot and what you're doing, explaining their product itself and what it's doing, who it's serving. And now let's just go into a segment where you can just further expound on this AI facts or fiction. There's a lot going on. Now you as the developer, having already, you already have a minimum viable product that has been there for a couple of years. So I'll just read out some statements and tell us if it's fact or fiction and why you see so.
Okay.
Yeah? So let's go. AI chatbots can replace human educators for sexual reproductive health. Fact or fiction?
Ooh, that's tough.
Is it?
Educators, yes.
Yeah.
They can replace, but then we look our goal as more as supplement the work they do. So if general awareness, general information, chatbots can sort all of that. If you need more fine-grained conversation,
the human element, human in the loop,
I'll go with fact. Go with fact. Educators,
yeah. So it can supplement but not replace.
Yes.
Okay, good. Second, people don't trust AI when it comes to private or sensitive topics.
Fiction. Because yes, this is not like an example of the other extreme situation. If you make it anonymous, people are free. No, we have instances in our data set where SophieBot has to tell people, the developers don't let me remember personal identifiable information. So some people give you their information. Some people want to flirt with the technology. If you make it anonymous, people will trust you with their most intimate their most intimate facts and their most intimate reasons. And that's why it takes so much responsibility and in the data we have and the data we protect. So yes, anonymous, make it anonymous, people will trust you. I'm supposed to give you short form answers.
No, that's good. No, the explanation really helps. You're the expert here on the whole AI thing. So great to know that. Now let's just get into the challenges. You've built this, deployed this. What challenges have you faced, even just beginning with things like funding? How has that been going?
The first step beginning ever was that the technology you're using didn't exist. So you had to learn to build out the technology. And two is, once the technology is there, we need to learn, we need to work on data sets. So the most extensive use of most cumbersome work on AI is data, cleaning through data, making sure all the responses are fine. Everything has been provided with a response for. Even when we work with the CBO, sometimes there are fields with empty figures. You think you make it as simple as possible for them, but then sometimes empty figures. Third thing is, we've gotten lucky. This is not to disparage the luck. We've gotten lucky. We've gotten a couple of funding programs, but the funding programs we get drive us towards impact figures, things that look good on reports at the end of the program. That's funny. How many views have you gotten? How many questions have you asked? There isn't as big a push on revenue, like you doing revenue and you building on revenue. And sometimes you might be penalized for using for spending all your efforts on trying to get revenue,
like a profit model.
So sometimes a couple of teams, I know you're only stuck in this grant cycle, one grant to the next grant cycle, and it feels like I'm privileged complaining. So it's a grant to grant cycle, and the grants themselves, I'm not about to complain about the amounts. It's about $10,000 to $30,000 amount. But then you're looking at AI startups out there spending $5 million USD just to train the technology.
Wow.
So ChatGPT was spent $5 million just to train the model on the technology that they're using, because it's more advanced. It's big. So probably it's an ecosystem that we're in. the most I know someone has raised, it's about $50,000 grant. If you're doing good, it's up to $100,000. But then that's tied to impact figures. How many people are you using? How many people have impacted? How many lives have you changed? So it's this constant cycle of that. Even when you get funded. The last is you're doing new things. You'll get challenges because people don't know the way they do. You're doing things differently. So, for example, SMSs. Most Kenyans know all SMS products are premium SMS products. Send for jokes, send 5 bob for. So when you're building a free product on SMS, you have to educate users to turn. You have to turn, like, go to messages and turn premium notifications, premium SMS notifications on. So that goes against the grain of every person building an SMS product. It's premium SMS product. It might unknowingly deduct airtime from the client. So telcos are protecting the client. It's every time you do something new, you're going against the grain that's been set up. The culture set up, and that SMS issue has been one of the outliers.
It's something like you're trying to leapfrog to a new system, but there's the traditional way things are. Things are that even like, so the technology and how they support SMSs, they only give you a way how to read SMSs that you're getting from users and how to send them back. But then you to building that system where I get an SMS this way, I send it this way, that's not baked into how those solutions. How those solutions. So you have to find a way and innovate around that, so that an SMS that's to be sent to you isn't sent to someone. I keep abreast of that thread. The last challenge I'd say is moving to new technologies. Like, is price. Is the price. Our technology, because we built it from scratch and we hacked it together, was cheaper to deploy. Cheaper in the sense that we spent $10,000 in credits in 2 years to deploy. If I picked a larger language model, and we fine-tuned it for SophieBot, me deploying it would cost $10,000 a month. a month on a cloud service. I cannot put it on. If I try and host it on my own machine, that whole machine, like, it'll cost more because they are very intensive on resources. Ours was we hacked Transformer together, so that's compute and power.
Compute power. If you get credits, the system is good. You get credits.
Cloud credits.
You get like I have access to about $100,000 in credits, but then that's only 10 months of you existing. So the last, it's very prohibitive. We can't use this larger models for our own use case right out of the box. But then you fine tuning them for your own use case is going to be prohibitively very, 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 very expensive. So that's the last. It's the last month of me trying to figure that was the last month of figuring out the challenges.
What about something like we know the case in Africa with internet penetration? A certain report showed that internet penetration is about 40.8 in Kenya. Other African countries are doing better, like Morocco is at 90.8, Libya, Seychelles, like 88 and 87% respectively. Has that had an impact on how you deploy these and people accessing that? What do you think has been the challenge there?
So we've kind of found ways to leapfrog and work around. So supporting SMS, supporting WhatsApp, and then because internet might be an issue, but then people get like bundles for the platforms where we deploy on. Sometimes when you're on Facebook, like they give you like a free data. So we found like ways around it, but I'd say it has improved. When I was starting out, because when you had an app, you tell someone to download something from the Play Store, but Play Store is disabled because they're worried about the cost of data. So we found ways to work around it. Internet penetration isn't even the cost of internet is the issue. Because somebody's spending. So I think cheapest offer you can get on is 100 bob a day. It's 100, you can spend 100 bob a day. So, yeah. So that cost might be prohibitive to some people. So give some people options outside from mainstream internet. But internet being like the cost of internet being prohibitive it also affects how people use the internet. Sometimes people are only online that 1 hour, that 8 hours they're at work because it's office Wi-Fi. Some people so Meta has an AI icon on the phone, but most people don't know what it is for. What it's for, because they only I'm only on WhatsApp to talk to someone else. So the cost of internet is a bigger problem. It's a bigger problem than penetration. When you were working with the CBO in rural Kenya, they all had Android phones. Internet may be a problem, but they all had Android phones, and you could build an app for them to work on. So yes, the cost of internet goes farther than and how data products are priced goes farther than internet penetration. But then as an entrepreneur, when you get the support, you find ways to work around it.
Would this bring you to have something like a USSD code to be accessed maybe on the feature phones?
SMS supports that, and we need to it's expensive on its own way, but then SMS supports support that and supports in feature phones. I even remembered I went to someone someone at home where I live when the first time we deployed SMS to try SMS on. So SMS works fine, because USSD is expensive, because when you get that menu on a code, they price that as a call. That is priced as a call. You
can't escape the cost.
You can't escape. And SMS, you price that per SMS you're given.
What about things like the regulatory frameworks for AI in Kenya? We don't yet have AI laws. There's the Kenya Data Protection Act. These laws, do you think they are any way prohibitive to tech AI that's changing every day?
I think it's first is enforcement is a bit tough, and then they only enforce when something goes wrong.
It's reactive.
It's very, very, very reactive. We haven't seen applications on AI yet, but we've seen applications the biggest street industry is loan apps. Loan apps are the ones who've been hit with regulations that I cannot, because I took a loan from, they cannot SMS you about my loan.
The privacy aspect also.
So the private, so even enforcement. So if my company does something wrong with something, the recourse is to manually file you have to actually talk to an actual government official to get that done. Abroad, large tech companies are getting sued for misusing customers' data by the company. You don't have to report. The government knows they need to enforce that. So we even at the point where the implemented enforcement will be a problem. But lastly, we've been fighting that AI practitioners. There's an AI practitioners law that regulations are not meant to protect the end consumer. They're protect to create a class of people who are there to benefit from from registering practitioners. So all laws kind of even the Data Protection Act created an office of the data protection. It's to create employment from someone else, not to protect consumers, and that's the problem with tech. A problem that might arise in Kenya is it's called AI-induced psychophancy. So you know how big AI models never tell you are wrong. They don't even know.
They're always encouraging you.
So they can encourage you to do bad things. They have safety nets and safety measures, yes, but then some people can go around them. So that has dire consequences abroad, and they might start getting and larger companies are getting sued for that, and that might start affecting us us here, and we don't have regulations. Our regulations only serve as much as creating jobs for someone.
Yeah, so those guardrails are not yet there. The safety nets.
Yeah, we never work to protect the consumer. We only protect the consumer after an app, like with the mobile lending apps.
Yeah. But I think with all these strategies coming out, I know in Africa currently, I think as of July of this year, 2025, there are 16 countries with AI strategies. Yeah. So out of our 55 countries, I think we'll get there. Yeah, definitely. So what about things like partnerships, other partnerships, like public-private partnerships? How is that going, the partnership angle? This ecosystem, you need other people to grow. How has that gone?
Yeah, I've always been someone on the angle, like partners is who you pay for something you can't do, like an SMS provider, GLAD provider, UNFPA giving us the payment curriculum. So most entrepreneurs are looking at like public institutions as a way to like get revenue, but the most you are getting is them as an implementing partner. And working with local governments like is easier and more possible than larger like the national government. And it starts with how health is funded in Kenya. Most health is funded through grants and aid. And when even us, when the few times we work with the Ministry of Health through UNFPA, it's always been always under the program of what they want from it is, can UNFPA then fund one of the programs? That's what drives things. First is, can one of your programs fund a specific key agenda for that the government is running? Or because you're never monetizing and getting revenue as government as a source. And even when you are, like, you have to oil some palms when you get there. When you get there, so it's easier for us to work with communities directly. The feedback loop is shorter, is faster. I've seen a couple of organizations like work with government, but then it's all implementing alongside them, or them working alongside an aid funded program for what they're implementing. Yes. As an angle for revenue, it isn't there. Just what is the agenda? And I gave it. I've given two examples where a county has a sanitary pad program. You are running a sanitary pad dispenser. Try you work with them as an implementing partner. So that's how most things are.
I think there needs to be clearer policies. We need a balancing act of autonomy. There's the collaborations. We need these multinationals for the research grants, but then we also need autonomy in the voices. Our people are leading these research programs. There's a balancing act that we need to get there.
Yes, and I think there we're going to like socioeconomic challenges and how to like go around them, because we solve a couple of socioeconomic challenges. More health can be funded by people. More health can be funded by our national health insurance. Taxpayers can a comfortable funding and that can fund, and then fund things down the line, and then healthcare startups can plan on revenue directly from consumers, and then at that point you can find ways to work with government to amplify your impact.
To amplify the impact along with what government already has planned.
Done. But then it sounds good, but there's maybe some embarrassing consequences. So like we have I won't mention names, but we have a founder who was dragged into a Senate committee hearings because of the program they're running with it's all understanding the risk. But for us, at the point where we are at, working with communities directly has way more impact than trying to implement.
Great. I hear that.
Bureaucracy. That's huge bureaucracy.
Great. And now tell us, now the company that you've been running, tell us, that leadership experience, how has that been going? Leading the team and all these other people you're working with, that leadership experience.
Yeah, like I've had to be pragmatic. So I can be very stubborn, I very much have tunnel focus when I want to do XYZ and XYZ. Yeah. So it's a whole new learning curve to be approachable, consider other aspects. But then my most valuable experience is having a network of people you contract out for specific, having clear specific rules, and you contract out work work with them. Our favorite partner is the guy who does branding branding for us. So he's been our longest running partner, and we contract out work exactly for them. And lastly is secondly is making things easier for people down the line. So if you do shoddy work, it affects down the chain. So you have your work must be impeccable to go down the so that it cascades down the value chain. Yeah.
That's a really good analogy. You need the people you work with, building that network of people, keeping everyone accountable.
But it starts with you. Your work should be good, and then because you're at the point you're expecting good work from people down the line. But then if your instructions are bad, if they're not clear, you need it's up. It's all and up to you. So I think me being hamstrung, being having tunnel vision is from ultimate responsibility is on me. But then once you bring other people to share with the burden, clear instructions make make work easier down down the line. The funniest accountability metric I've had is when we were working with the CBO to translate our data set. We could every question and answer pair was tagged to someone's email. So whoever submitted you could trace it back to them and no, please fix this. Lastly is I have a quick feedback. Whenever something is asked from me, I want to get feedback to them as fast as possible.
I like that, the tunnel vision and how you're navigating what I like to call the founder's burden. You're carrying the vision. So, and now let's go to the future. Where do you see SophieBot even in the next decade? What are your hopes? What impact do you see SophieBot having?
Yes, if asked me a month ago, it will be now we support one local language, translating our data set into new into new languages and supporting and being able to provide information in that way. So that is one. But then the second is leveraging. So the technology with large models has evolved to the point where they're making smaller models. It's probably expensive, yes, to deploy it, but can we fine-tune larger models with the same data set we have for sexual health in multiple languages? We want to support that at scale. we want to be the go-to resource for sexual health, like all technology, reliable technology for sexual health and purely sexual health. Can we work on us? So it'll get to a point where it's a mix of our model or working with fine-tuning larger language models and solving that for them. But that aside, our value proposition has been selling the technology we are using to answer our users' questions on sexual health as a customer support tool. We could land a couple of clients to do that. We want to grow and scale that so that it can pay for people answering questions, for people asking us questions for free, so you can keep making the product free and cheaply as possible for most users. Yes,
I like the aspect of you want to be the go-to chatbot for sexual and reproductive health, the scale, the sustainability, very good goals over there, very good vision, and I'm sure you will get there. Yes. I have really enjoyed this conversation, Irving, and I am sure the audience will also really enjoy and just interact with SophieBot, get those questions answered, and just make a healthier future, one conversation at a time through SophieBot.
Thanks for having me. I also love the conversation. Thanks. I sometimes feel like I hog the conversation and take so much time, but then it's been a beautiful back and forth.
Yeah, no, you've really explained it well. Very informative. Thank you. This has been AI Health Bit Africa. We have been discussing about SophieBot that is providing trusted sexual health information with dignity, with privacy, and in our own cultural context. And until next time, stay curious, stay connected. Bye for now.